Good afternoon. I'm Janae Talbot, Public Relations Director with Russell Regional Hospital, and welcome to Health Shift. This is a new video segment that we are starting here at Russell Regional to introduce everyone to our departments and the different services that we offer here at Russell Regional. Go ahead and give us a like and a share on social media as well as on our YouTube channel. We'd really appreciate that to help spread the word and promote what we're doing here at Russell Regional Hospital. Today I have with me Sarah Von Felt, who is the Director of Social Services. She's a hometown girl, grew up here in Russell County, and I will let you tell the folks about what you do.
Okay, so I'm Sarah Von Felt. I'm the Director of Social Services, and I'm also the licensed social worker here at the hospital. And what I do is I oversee social services in the hospital setting, the clinic setting, and also for our long-term care facility, Main Street Manor. And that really is a very broad description of what we do, and I don't do it alone. I do have 3 really great staff members who help our patients in each of those settings. And so the focus in each setting is going to be a little different. In the clinic, Rajeen, the case manager over there, she's working on more long-term goals with patients. That's going to be things like applying for health insurance, whether that be Medicaid or Medicare related services. She's also going to be helping people with applying for Social Security benefits, maybe helping process those Social Security disability determinations, which take a lot of time and follow-up. Her focus is also going to be on medical related case management, which can encompass things like housing, maybe transportation, prescription cost barriers. She's going to be focused on helping people meet their health and quality of life goals.
Great.
And a lot of times that's financial, but there's a lot that's tied into that Rajeen works on. So she does that in the clinic. Here in the hospital setting, the case manager discharge planner on 2nd floor, she helps the acute and swing bed patients with finding care, maybe in-home care once they go home from the hospital. She also helps make referrals for DME supplies or any other in-home equipment for folks to help prevent that readmission and for them to remain in their home independently. She also helps with, if folks do need a higher level of care, referrals for nursing facilities or any other type of specialty units, depending on what the patient need is. Okay. So she's a part of that piece of it with discharge planning on 2nd floor. And then our long-term care facility, Main Street Manor, staff member Sierra up there, she helps improve the quality of life for our residents.
Yes.
Helps complete assessments that are required for nursing facilities, and she's also a really vital part of the care team and making sure that patient rights are met and that quality of life is at the forefront of care.
Great.
So I oversee all of that and step in and help out when I can.
And do you charge for your services?
We do not. Social services are considered a support service, and we are just another part of the care team, and it just comes with our care here at Russell Regional.
Do you have different resources for different clients depending on what their need is?
Yes, yeah. It really just depends on what the patient needs. Every patient situation, each person's life is going to be very unique to them and what they're needing in that phase of life, what type of support they have, whether that be financial, emotional, family support. Each person's going to be different. So we have lots of resources that we pull on in the area. There are certain needs that we don't have a lot of resources for, like transportation is a really big one. Yes. But we get creative and we try and pull on every resource we have, and we sometimes just patch things together in the best way.
Right. Right. So if any of our listeners are interested in going into social work, tell us a little bit about your journey growing up here. Sure. and moving into social work as a career.
So social work as a career is broad in a beautiful way, meaning you can do so much, and it's kind of a chameleon in the way that you can apply your skills. So healthcare is just one setting, but there's social workers in the school systems. You can be an independent practitioner. There's so many ways that you can apply your skills with different populations. And so that is the most exciting thing to me, is that you can really switch up your focus, and it's not applicable in just one way. You can make it your own. And so I just knew growing up here in rural Kansas that I wanted people that I care about and our community to have access to a caring and informed professional service that can connect you with the services or the resources that you need. So yeah.
When you're working with your clients, do you find that they're aware of resources, they're just not sure how to access them, or are they unaware of what's available?
Yeah, I think it's a little bit of both.
Okay.
So I think people have a lot of times our patients have a general idea of what's out there, but maybe they didn't realize that they were eligible for it. Maybe they've heard of it, but they didn't know how to get in touch with how to make that happen. Or maybe they're just misinformed.
Right.
That happens a lot too. So I feel like the biggest piece is just connections are huge. And informing people, educating people, that's one of my favorite parts of this job, is just sharing what's available. And a lot of times folks are surprised that they can get that help,
Right.
and it's not out of reach for them necessarily.
And do you find it's kind of intimidating sometimes for clients at first to know who to call and to have the courage to make that phone call?
Oh, absolutely. That's something that I talk to my staff about a lot, is that our patients are focused on what they have going on in their lives, whether it be focused on their health and how they feel first and foremost, just physically or mentally how they're feeling. And so then to navigate those needs that they have of like,
Sure.
This would really make my life easier, but trying to get in touch with that can feel so out of reach. And that's why the case managers here, that's really what we want to do, is let people focus on their health and let us help them get in touch with what they're needing.
Sure. You've done a great job expanding your program. What drove the need for that expansion?
Well, I think that only one person can help. One person can only help so much. So I just knew that getting a case manager in each area would really maximize the services that we can provide and make it a quality service across the board, and allowing those staff members to really focus in on that service area, meeting the needs for the patients in that setting, and focusing on the goals for their patients instead of it being a one-woman show where I'm trying to shape shift to each setting.
Right.
Allowing each of those staff members to really hone in on the skill set they need for that population and meeting the needs of those patients.
And what is the best way for people to contact you to either learn more about what services you may offer, or how do they access those services?
Yes, so like I said, on the second floor of the hospital, the long-term care floor, or over in the clinic, there's a case manager in that area. So if you're receiving care in that area, social services will likely have a piece of your care. If it's not initiated by your care team, you can always reach out and just say you'd like some extra help from social services. I'm always available to the public. I have people who come and just want to visit or have questions, and I'm more than happy to help.
Okay.
So you can come to the hospital, just to the lobby, and request Sarah with social services, or one of the social service care team members. You can also call my office phone to reach me, or call the hospital.
Sure.
So do you want me to list the contact info?
Sure, that'd be great.
Okay, so you can just call the hospital at 785-483-3131 and just ask to speak to the social worker, Sarah.
And do
So-
you have needs that if people have a heart for social work and want to help build the birth program and they want to donate financially, do you have some needs that could go, those donations could go to?
Yes, so there are certain products or certain equipment that's not necessarily covered under insurance plans that we see our patients a lot of times need. And so funds could potentially go towards social services developing maybe some type of program that's based on financial need, maybe
Okay.
medical need, to allow folks to get things like diabetic supplies, or maybe they are needing some compression hose, or just different things
Right.
like that fall through the cracks of not being covered by health insurance. And when you're on a fixed income or whatever the situation may be, those little things can really make a difference in a person's health outcomes. So
Sure.
we would love to be able, we see a lot of times where we don't have the resource to meet the need.
Right.
And when we have those needs repeated, upon several patients, a lot of times the case managers would love if we could just provide that to patients.
Great.
So
Is there anything else you'd like to add that we haven't talked about today?
I don't think so. Like I
Okay.
said, I don't do it alone. I have great staff, and we're always happy to help our patients however we can. And if we don't know the answer, we will do our best to find the answer.
Okay, thank
So,
you.
Yep, you're welcome.